Okay, it is 7. I shall begin. So hi everyone. Thank you very much for joining, and welcome to this first ever street drugs discussions. I think my long lecturing experience shows me I should add some good waffling until some latecomers are allowed in. The idea behind this is, well, we've been doing some physical street drugs conferences for a while now. Joe Neal, who is also here working on the back channel, started this up in Manchester a few years ago. I turned up to one of these as a punter, and then after that, me and Joe organised one down in London with Chris Chandler, who is also here down on the back channels. These continued as doing physical conference events, and we had a great one lined up for June the 11th in London. But obviously that was not a time for physical social events to be happening. And so we thought we very much wanted that one to happen. So we tried to think of some way that it would do. We kind of thought that a whole 6 hours of webinar might be a little bit too much and a terrible idea. But we liked the speaker lineup very much, so we chopped it up into little pieces. And the headline act of Niamh Eastwood of Release and Daniel Pryor of the Adam Smith Institute are here for the first one. Our very optimistic aim is to do these once every 2 weeks. We'll see how that goes, but we have actually got one for 2 weeks' time as well. So definitely watch this space, and please, someone on the back channels, remind me to promote our further events at the end of this, as I'm sure I will definitely forget. So today's talk is, what does a good drug policy look like? And so I'll start off. So yes, the spoiler I will give is that I think neither of our two guest speakers are advocating for staying with the status quo. So we will discuss some issues with status quo. We might look at what the aims of a good drug policy are, the shape of a good drug policy, pug policy, not what I meant, the details of a good drug policy, sorry, and how we should get there. This will hopefully be quite an interactive sort of a thing. So I believe the chat is open. So please put your questions to the speakers onto the chat. I think the plan is that I'll let the two speakers introduce themselves and their viewpoints. Then we'll hopefully have a conversational thing going. Well, they said first time we've done this, having to do it online, etc. We'll see how it all works. And then we will introduce some questions from all of you who are listening and partaking. But please do put your questions in as you have them. Good ones will be sent through to us on the back channels, and and the more interactive, the better. So I think without too much further ado, so again, thank you everyone for joining. We have currently 60 there, which is great, and quite a few names I'm recognizing. So thank you very much, all of you. I've heard that across the UK, I believe most of you are probably in the UK, it's intolerably hot. I'm actually in a tropical country right now, and I think it's actually less hot, remarkably. So thank you very much all for braving sitting still and somewhere indoors, assuming you are all indoors. So without further ado, I will invite Niamh to begin.
Okay, thank you, James, and thanks to the team for the invite to talk today. Thank you to all of you who are joining us on a very hot day in London, 36 degrees. It's lovely to see some familiar faces and to welcome people I haven't met before. So my name is Niamh Eastwood. I'm Executive Director of Release. Release is the UK Centre of Expertise on Drugs and Drug Laws. We provide legal expert drug services to people who use drugs, and we campaign for reform of the drug laws based on policies and approaches that are commensurate with the evidence and that focus on the individuals, both in terms of their dignity, that they are treated with equality, and respect. And I'm happy to talk more about what Release does in the questions. So James has outlined kind of some of the things that he wants Daniel and I to pick up on. And so to start with kind of the failures of the current UK drug policy, many of you will know this, But the main focus of the prohibitionist framework within the UK is a criminal justice one. So we overwhelmingly respond to drug use as a criminal justice issue. And I think that's evidenced when we look at the spend on law enforcement in the UK annually. So the Home Office has stated that we spend 1.6 billion on drug law enforcement annually, every year. And their own evaluation of that activity has shown that it has little to no impact on the supply of drugs and describes the drug market as resilient. But the point of this, and I think saying that it's a criminal justice approach is fair when we look, say, for example, for the budget lines for treatment. So we spend about 600 million a year on treatment, so almost a third less than we do on law enforcement, and those are ever diminishing budgets in a time of austerity. At the core of this policy is the idea that criminalisation would deter use, does deter use. But in fact, repeated academic studies have shown that that is not the case, and Professor Alex Stevens' work in this area is of note. More particularly, if we look at the Home Office's own evaluation again, so this is a report that they published in 2014, comparing the experiences of 14 countries across the world, some of whom had taken a less punitive approach that had ended criminal sanctions for possession offences, and others that were much tougher in their response, so like Japan and Sweden. And what that report stated in its conclusion was that tough law enforcement does not deter use. So this is a failed policy in terms of its own kind of central goal. But what we do know is that the current UK drug policy causes significant harms. And I think those harms are borne out in a number of areas, but just to highlight two, drug-related deaths are at the highest level since records began. And that is for the 7th year in a row. And from the work that we do, it is distressing and depressing that every year for the last 7 years, we have had to make that statement. Moreover, criminalisation is not applied to all people who use drugs. Criminalisation disproportionately targets young people, those who we're trying to protect within our drug policy. It targets people who live in deprivation, and it targets people of colour. So research that Release has undertaken has shown that Black people are 9 times more likely to be stopped and searched for drugs, despite using drugs at a lower rate than the white population. And when they are caught in possession of drugs, which is in the vast minority of cases, they receive harsher criminal justice sanctions. So in our view at Release, drug policy, not just in the UK, but in many parts of the world, is a form of social oppression and a tool of social control and a form of racial oppression. Currently, the aim of drug policy within the UK is measured by prevalence. So success is measured by the numbers of people using drugs. So regularly, you'll hear the Home Office making statements such as, drug policy in the UK is working, drug use is falling. Well, that's a misrepresentation of the stats, but it shows that for them, the main outcome is to reduce drug use, not to reduce harms. And in our view, an effective drug policy should be measured on reduction of harms. This would include deaths. As I've mentioned, we have record drug-related deaths. The UK accounts for 1 in 3 drug-related deaths in Europe. The reduction of BBVs. We've seen most recently the outbreak of a HIV transmission in Glasgow amongst people who inject drugs. We have also seen an increase in hepatitis C rates amongst people who inject drugs. These are really worrying trends. And there are other health harms obviously associated with criminalisation, as that policy will increase risky behaviours, such as injecting drugs quite quickly in order to avoid detection, therefore risking risk of injury. What our drug policy should focus beyond reduction of health harms is also on social and economic inclusion. And what this means in practice is investment in harm reduction, investment in treatment, investment in social inclusion policies, including housing security and improved family relations, a reduction in stigma, and an increase in economic participation. And none of these things are achievable whilst we continue to criminalise people who use drugs. So at Release, what we advocate for is decriminalisation, and that is the ending of criminal sanctions for possession offences. It can be extended to other activities, but in the main, possession offences. Research, again, that we have done with the International Drug Policy Consortium, and that's published on our website, Talking Drugs, which I'd encourage you all to go to, shows that 29 countries across the globe and 49 jurisdictions, that's mainly US states and Australian states, have adopted this approach. So they have either decriminalised cannabis possession or decriminalised possession of all drugs. And in the main, it is all drugs. Cannabis possession decriminalisation is actually an outlier, mainly in the US. None of those jurisdictions saw an increase in drug use linked to the legal reforms. So those concerns that politicians have about it encouraging drug use is unfounded. And for those countries that have coupled the decriminalisation approach with investment in health, in harm reduction, in treatment, they've had really successful health, social and economic outcomes. Many of you will know about Portugal, but I am going to mention it because it is the most researched of the countries that have adopted this approach. So Portugal ended criminal sanctions for possession offences back in 2001. In the succeeding years, evidence has shown us that problematic drug use has fallen. The number of young people transitioning to heroin has fallen. There has been a significant reduction in the transmission of HIV. There is a reduction in drug-related deaths, which I will come back to. Injecting drug use fell by 40% in the first 10 years of the policy. There has been a less involvement of the criminal justice system in this activity, as it is treated as a public health issue. A reduction in the number of people going to prison. And for the state, for the Portuguese state, there was a saving of 18% in social costs in the first 10 years of the policy. So this can save money as well for governments. And unfortunately for governments who don't seem to care about the rights of individuals or the health outcomes or social outcomes, the economic arguments are strong. The Czech Republic also decriminalised drug possession back in 2010, and they have similar outcomes. And I just want to focus in on drug-related deaths. So Portugal and the Czech Republic have a drug-related death rate of 4 per million of the population. You compare that to the UK, where it is 76 per million of the population. And in fact, all of the European countries that had some form of decriminalisation, that includes the Netherlands, Germany, Italy, and Spain, as well as Portugal and the Czech Republic, have lower rates of drug-related deaths than the EU average and significantly lower than the UK. So if we want a policy that improves health, social and economic outcomes, then decriminalisation is the starting point, as it will end the criminalisation of all people who use all types of currently controlled drugs. If we focus on legalisation and regulation, then it tends to be drug by drug. So at the moment, the only real opportunities in relation to regulation are in respect of cannabis, which is really positive, but that does nothing to reduce drug-related deaths amongst the most vulnerable population, those who use opioids. And whilst release supports regulation, and we support a certain type of regulation, which I hope we'll get into in the discussion, we do not think regulation can move forward without decriminalisation. And often decriminalisation and regulation are set up as opposing policies, or that decriminalisation is some halfway house that leaves the production and supply in the hands of unregulated suppliers. I do not think it is either a halfway house, nor do I think that it is a policy that works in opposition of regulation, but rather that decriminalisation and regulation are complementary and necessary policies that must be pursued in tandem in order to reduce the harms of prohibition. And I think Canada is really instructive on this point. As many of you will know, Canada regulated cannabis back in 2018. However, they continue to possession of cannabis outside of the regulated market. So criminalisation of illegal cannabis is an offence. And so returning to the point that I made at the start about the failure of our current drug policy, I highlighted the fact that criminalisation focuses on those living in deprivation, people of colour and young people. These are the people who are likely to be excluded from the regulated market in Canada as a result of the costs involved in purchasing it due to high taxation. And so those people will continue to be thrown under the bus of prohibition. So for me, the Canadian model is a failed model because it continues and repeats the harms of criminalisation that decriminalisation can address. So those are my points. Thank you, James.
Thank you
Great
very,
stuff.
very much, Niamh. And yeah, Daniel, please. So please introduce yourself and please give us your opening salvo.
Yeah, certainly. So thanks a lot again for inviting me along to this. It's a real pleasure to have this chat, especially with Niamh, because we're going to have some great, I think a lot of disagreements, a lot of agreements in ways that might be quite surprising. But I guess to start off, yeah, my name's Daniel Pryor. I'm head of programs at the Adam Smith Institute. And for those of you who aren't familiar with us, we're a policy-focused free market think tank based in London. So we take a kind of classical liberal free market view on various policy issues, and as well as trying to change government policy in various areas, we also try and change public opinion as well. And we do that in a number of ways. So things like media advocacy, but mainly our policy research. And I'm the guy at the ASI office at the moment who concentrates most extensively on drug policy in various different forms. And to give you an idea of where we stand and the sort of work we're doing in the broader drug policy field, we've supported cannabis legalization and more broadly drug reform relating to other substances since pretty much we were founded in the late 70s, and it's a thread in our work that's continued for decades. Most recently, we've just released last week a paper looking on the medicinal side of reform for psilocybin, the active ingredient in magic mushrooms, and looking at how that can be best harnessed to treat treatment-resistant depression and various other cases of mental ill health. We also look at the kind of harm reduction side of things when it comes to drug policy. So we're firm supporters of drug consumption rooms, as well as things like festival drug testing. But I guess the kind of centerpiece of what we focus on most is in relation to legalization of various different substances, but particularly cannabis is the one that's been mentioned and the one that we focused on most in terms of our research and our advocacy most recently. And there are, as Niamh has already said, there are some very good reasons to care about drug reform, whether it's decriminalisation or legalisation. We're in a situation in the UK where a huge amount of people have use drugs on a regular basis. I mean, 1 in 3 people in England and Wales have tried cannabis at some form in their life. 1 in 10 young people have tried Class A drugs in the past year. And we're also in the situation where, as Niamh mentioned, drug death rates are extremely high. In Scotland, they are the highest currently in the European Union. And we think that at the moment, there's actually quite a good impetus for change in relation to the legalization of cannabis. So if you look at the most recent polling, you're starting to see majority public support, and that's fairly well distributed across age groups and political party, although obviously there's some differences. If you look at, for example, the breakdown of polling for support of legalizing cannabis, then you find Lib Dems and Labour, fairly unsurprisingly, there's majority support, whereas it's split around 50-50 amongst Conservative voters. I guess kind of to go over some of the problems that I see with our current approach to drug regulation more broadly, and Niamh has mentioned several of them. There's the obvious easy youth access. The classic drug dealers don't ask for ID. We've got unregulated, more dangerous substances as a result of contamination, uncertain potency, drugs currently being missold as other substances, and no health information or quality control. And of course, our huge violent criminal market, which is worth billions. Overall, the UN, I believe, has estimated that the overall world market in illicit drugs is around 1% of global GDP. And of course, the end result of this is that you end up with organized crime going in power and often subsidizing other crimes with the proceeds drug sales. There's a postcode lottery in terms of enforcement of our drug laws in the UK as well. Different police forces continue to enforce what we have on the books, varying levels of intensity. And this is something that if you're a kind of someone who's concerned about the rule of law, it's not a good situation. There's this kind of idea that, well, we don't have a war on drugs when it comes to, say, cannabis, for example, because it's not enforced as harshly as it could be. I think that is complete nonsense, to be honest. There's been hundreds of thousands of criminal convictions for cannabis possession in England and Wales in the past decade or so. As Niamh mentioned, there's some racialized enforcement aspects, which are a particularly large issue. And there's very strong evidence that the kind of criminal records and cautions that people are getting on a regular basis from our current system destroys lives. Criminal records can affect people's housing, employment prospects, travel prospects, much, much more. And of course, again, the one that's kind of been in the news more recently is in relation to the growth of county lines gangs and the child exploitation and trafficking that's involved in that. There's thousands of teenagers who are estimated to be involved in county lines drug smuggling operations, and that's just in London alone, and human trafficking in relation to the domestic UK drug industry is fairly well documented. So onto the kind of the question of this webinar of what's the best way, what's the best legal approach to this? Well, the first thing that pops into many people's heads is, well, we should simply double down and we should actually increase our enforcement. And the big problem is that we're not enforcing the laws that we have on the books enough. We need to dedicate more resources to policing and enforce our existing laws. As Niamh said, there's very little evidence that this affects overall prevalence rates and use rates. Alex Stevens has done some great work on this. The Home Office themselves have found no association between the levels of enforcement of drug laws and the overall levels of illicit drug use. And it's also important that we distinguish between drug use and what could be described as problem drug use, because they're not the same thing. And prevalence is not a very good way of measuring harm when you've got all these other factors that I've mentioned coming into things as well. It also doesn't seem to densify harsh enforcement. If you look at the kind of the situations where you'd expect there to be very harsh enforcement, we obviously can't keep drugs out of our prisons. We obviously can't keep them away from our borders, the two of the most kind of policed and enforced areas in the UK. And of course, the other point that I'd make is, as a kind of classical liberal, as a free marketeer, I think that there's a principled objection to this. If you buy a liberal view on the freedom for informed adults to decide their version of the good life, then actually you kind of oppose this on principle as well. Now, as Niamh mentioned, there's decriminalisation as a potential approach here, a kind of public health approach focusing on drug users, and in the meantime, maintaining the kind of focus on tackling illegal supply. I think that this has got a lot of merits to it, and like Niamh, I don't think that decriminalisation and legalisation need to be set up in opposition to each other. I used to think that this was the case. It's something that I've changed my mind on over the past year and a half or so, mainly because I was concerned that actually going for something like decriminalisation would end up poisoning the well against further reforms towards legalisation. And kind of worried about that, because with decriminalisation, you don't have initially the capability to take on the supply side of the illicit drug market. And of course, you still have all of the issues associated with that. But it's certainly an improvement on the status quo. And I think if looking at the path that, say, the US states have taken, for example, and that many other places have taken, it hasn't gone decriminalize and then no further action on legalization. It's actually gone decriminalization, and then later on, there's been further reforms, potentially, say, legalization of cannabis, for example. So after I'd kind of looked at what has actually happened in the countries that have first decriminalized and seeing where that's led to, I'm pretty convinced that actually decriminalization is quite a good route to legalization, and also very, very good in itself. And even mentioned some of the Portuguese evidence that I think is very strong. But for me, certainly the end goal for drug policy, and this doesn't just apply to cannabis, this applies to various other commonly used illicit drugs, MDMA/ecstasy, for example, is some form of legalization. So the idea of either businesses or state-run legal outlets with regulated supply and legal consumption. And perhaps unsurprisingly for a more free market focused think tank, we have our own kind of model of what we think legalization should look like and why we think it should look like that. But the basic premise of it is that you're taking back control of that supply side as well. Something that I think is very important and something that decriminalisation sadly isn't able to achieve in and of itself. So I guess I'll end it there and we'll go on to some more chatter.
Great, thank you. And I think that opened us nicely. So you finished by saying you don't think that decriminalisation regains control of the market. Niamh, have you got a counter to throw in against that one?
Yeah, I agree that it doesn't take control of the market in terms of the production and supply of drugs. That being said, I mean, the example I give of Canada worries me deeply that we would, you know, if one of the aims is to recognise drugs as a public health issue, then the involvement of the criminal law to any extent fails that approach. So I think that's the first thing I would say. I think, you know, the main issue for me is around what type of regulation are we talking about? If we are talking about regulation that is driven by capitalism, market interests, and essentially promotion of drugs, which I'm not against promotion of drugs, but, you know, aggressive advertising, targeting, etc., I would have concerns about that. I also, and I think, you know, if you look at the medical opiate market in the US, I think those concerns can be borne out. So the pharmaceutical push on the opiates in the last 10 years in the US has contributed, is part of the reason that we have really high drug-related, opiate-related deaths in the US. For me, regulation needs to be grounded in the principles that we work around, and those principles are social justice and racial justice. And I'm happy to get into models that have come out of some of the US states that seek to recognize that drug policy reform and the establishment of legal cannabis markets is an opportunity to work within the kind of concept of reparations to African American communities and Hispanic communities who have been over-policed and over-incarcerated. So for me, those are the kind of things that we're talking about. And if you talk about regulation in absence of those things, then my view is that you are going to create prohibition 2.0. That's it. You know, we're not going to solve the problems. It is the most vulnerable in society, the most disenfranchised, the most oppressed who are affected by these laws. And a capitalist-driven approach is not one that will seek to remedy those harms.
So just to kind of respond to that, because it's a point that I have some sympathy for when it comes to, well, if we have a kind of complete free-for-all regulatory regime for any sort of drug, then you're not going to be able to achieve various aims relating to say compensating the victims of the current war on drugs. I think there's actually a fair amount of overlap between a more liberal approach and achieving those aims, at least in some areas. So when it comes to, say, licensing, for example, if you look at the US states or Canada, when it comes to whether you can set up your own cannabis business there, in some situations, you have a case where it's very, very difficult, where there's either a restricted number of licenses, or if you want to, say, start up a small micro cultivating cannabis business, then you have to already have your facilities before you're even allowed to apply for that license. Various things like this are kind of bread and butter issues for kind of free marketeers like me. And one of the problems with them is that they lead to excluding the very people that are most harmed by our current legal regime from participating in the new legal regime. I'm sure that there's certainly areas, I mean, say, for example, advertising and promotion, where me and Niamh have different views, but I think it's worth kind of highlighting that there is definitely some crossover here when it comes to, say, allowing people to home grow cannabis, for example. Again, kind of there's fairly clear libertarian justification for allowing that, but there's also the aspect of, well, that completely removes one way that people can be recriminalized even in a legalized regime. It's worth as well kind of, I guess, spelling out that whilst we're at the Adam Smith Institute, we are kind of libertarians, free marketeers. We don't advocate for a free-for-all when it comes to regulation. It's not as though there would be no advertising controls, there would be zero taxes, anyone could do anything they want. I think when we released our most recent kind of blueprint of what a regulated cannabis market would look like, it surprised a few people, at least, who are more on the kind of progressive left of the drug policy reform debate, in that it wasn't quite as hardcore as they expected. And the reason for that is that we're concerned with harm reduction and pragmatic policy. It's not a case of, well, principled defense of free markets and drugs, that's all we care about. We're concerned with designing regulations that do achieve the various aims that we set out to achieve. Now, there might be some discrepancy in what those aims are, but I think if you say look at something like undermining the illegal market and making sure that legalization actually does what it says on the tin and works, there's some kind of arguments around taxation there, for example. I saw we had some questions in already. Should we maybe get to those, or I don't mind how this works, but
there were actually quite a few. There seems to be a growing theme about drug consumption rooms. I think that's something you've talked. I know Niamh has talked about that before in a webinar I thought I could come to before I got the time difference wrong. But so, Niamh, do you want to say a little bit in answer to some of the questions on drug consumption rooms we've got down there in the chat?
Yeah, I've tried to answer some of the factual ones, and I think other people did help him with that, which is great. But in terms, there's one question that's about why is the UK so opposed to DCRs? So on this point, I think it's a really interesting debate around DCRs at a political level. I want to bring drug checking into this as well. So many of you will be aware of the drug checking facilities that have been provided by the Loop in festivals and in some town centres. And that's a brilliant initiative that allows people to bring their illegal substances to be checked and to find out what's in them and get a bit of harm reduction advice. So fantastic initiative. But when asked about drug checking facilities in Parliament, the drugs minister at the time said that this was a decision because essentially drug checking facilities are illegal. They are contrary to the Misuse of Drugs Act, because by the very nature of bringing a illegal substance to be checked, you are in possession of it. So there is a breach of the NDA there. And what the drugs minister's response was, it's up to local areas to decide whether they support these initiatives or not. We're not going to get involved. It's up to local police forces, public health, etc. And I think when we think about the profile of the people who are mainly accessing those services, especially in festivals, young, middle class, people who, if they tragically die, they end up on the front pages of newspapers, and it is a tragedy, and preventing that is really important. But there was a tacit support there from government, I think. You compare that to drug consumption rooms, which engage a lot of the similar legal issues, namely possession of a controlled substance. And there was an absolute block at government level. They refused to allow the police to make local decisions on this. In fact, their words were something to the effect of the activities engaged with through a drug consumption room are criminal offences, and we would expect police forces to implement the law, to uphold the law. And I think then if you start to look at the profile of people who are accessing those services, these are largely incredibly vulnerable, excluded people, many of whom use in public spaces, many of whom are homeless. These are not people who are seen as having political capital or any other type of capital. And so I think that's partly why we've seen a real reticence to supporting these initiatives at a government level. I think it's more about the people than the intervention itself.
Yeah, I'd certainly agree with that. I think it's clear that the kind of the Home Office could have come out against festival drug testing by saying, well, what if it increases drug use, which is exactly their kind of objection, and the objection from number 10 to drug consumption rooms as well. And the fact that they didn't, and they have for drug consumption rooms suggests to me that there's just less of a political case for them, and it's because people involved with DCRs and who use DCRs don't have that political capital. For anyone here who kind of is less familiar with what these drug consumption rooms are, it's basically allowing people to use illicit drugs, commonly injected drugs, in a medically supervised environment. So there'll be trained staff and nurses on hand to kind of provide harm reduction services, and also have things like naloxone, which I believe I'm pronouncing, correct me if I'm wrong, yeah, good stuff, which is a kind of anti-overdose medication that's useful. And it's something these facilities are being operated around the world. Like, the UK is undoubtedly an outlier here. I mean, they're in Australia, France, Denmark, Canada, you name it, they're across the world. And the UK has stubbornly resisted allowing even trials to take place in areas of very, very high drug-related harm. I mean, you look at where the kind of current push for a trial is in Glasgow City. The drug death rate there over the past few years was over 1,000% higher than the European average. And the kind of objection that has been raised, we saw a few months ago, I think in, when was it? In January, this was raised in Prime Minister's questions, and Boris's response was, well, what if it encourages more people to use more drugs? Thankfully, we have a 2014 systematic review of 75 different studies, none of which concluded that DCRs increased drug prevalence use. Even if they did, I would still support them, because it's not about prevalence, it's about stopping people from dying. That's the most important aim when it comes to harm reduction. And we released a paper on this, I think a couple of years ago now, called Room for Improvement, which kind of looked over the fairly large amount of international evidence showing that these drug consumption rooms, they reduce drug-related deaths, they reduce emergency call-outs, there's decreased visible public objecting, so the kind of I guess drug NIMBYs, if I'm not sure that's the right term, that people who are worried about, understandably, things like needle litter, for example, in their local community, they tend to welcome these. And of course, because when they're done properly, they're integrated with other services, they're going to help people out in various other ways as well. So housing services, for example, it's a good kind of hub to access these allied services. And you tend to get increased referrals to drug treatment centres as well. So initially, the worry was, well, from the Home Office at least, their point was, which were all about recovery and all about stopping people from using drugs. And the DCRs do not immediately stop people using drugs, so therefore they're worthless. Well, I mean, that's a wrong basis to start off with, but even on that basis, they increase drug treatment referrals as well. So they're more effective at doing that, especially for the more difficult to reach marginalized groups like the homeless community, who might not have the access to the sort of services that do already exist in this area.
Just picking up on Daniel's point about what Boris said at PMQs about encouraging drug use. I mean, it just is such a great example of the sort of reductive and unintelligent response to this issue. The idea that the establishment of a drug consumption room that allows people to inject heroin will encourage someone to inject heroin is a nonsense. You know, can you imagine it, one set up in your local town, and you suddenly go, oh, there's a place I can inject heroin. No, I'm going to inject heroin. You know, it's just, it's a perfect example of the kind of political sort of idiocy in this area.
Agreed.
I mean, so yeah, very much agree with you both there. And it seems that something in the drugs workers harm reduction community, there's pretty much unanimous agreement. When I've been to service users conferences of drug users themselves, unsurprisingly, the injection drug users are for it. Yeah, I visited one of those in Frankfurt, and we have a really good place, which has got pretty good results to it. On that topic, something I'd like to ask you both, interested in your viewpoints on. So the drug consumption rooms we're talking about are ones where I believe in nearly all cases the users will bring their street heroin to them. So what are your views for both of you on the idea of prescribed heroin places where someone with, I mean, I don't know if either of you have got a particular shape of a policy for this issue you'd like to see, So yeah, would you believe in going back to, what was called the British system, where for, a good 50, 60 years, you could go to your doctor and say that you had a heroin addiction, and they say, okay, well, we know what drug you need as a prescription then, and prescribe you the heroin. Would you welcome that system? And if so, how would you implement it? Would it be ideally, would your drug consumption rooms come with a prescription supply? Would you work it like that? Would it simply, I guess, tell me how you would work that or wouldn't work that?
Sure. Go on. Sorry. Yeah. I mean, I was reading about the British system last night. Actually, it's just super interesting to me how for so long in this country we had a system that worked extremely well, of dispensed heroin from pharmacists, and sadly that's now gone. But yeah, I think that the idea of trying to integrate that in with existing drug consumption rooms, as an ideal, I think is a good one. The concern that I have is that, well, and it's something that's not ideal about drug consumption rooms, is not everyone is going to use the heroin that they get from, or the heroin substitute that they get from a drug consumption room in a drug consumption room. So it's not as though it's a panacea, but it's certainly a way that you can ensure you've got the maximum level of harm reduction available at point of acquiring the heroin, for example.
So we still prescribe heroin in this country. I mean, I have to point out, we prescribe it a lot in hospitals for pain, physical. But in terms of treatment for drug dependency, there's the heroin-assisted heroin-assisted treatment clinic that's running up in Middlesbrough, that was established, I'm going to look at Judith because I can see her, last October, Judith, 2019. Thanks. And it's got a number of clients who are being prescribed heroin on a daily basis. They attend twice a day. Judith, if I say anything wrong here, just go like that and then I'll ask you to correct me. And to date, the outcomes are fantastic. So I was actually writing about this for the Black Review, which is a big Home Office review at the minute yesterday. And it was estimated that I think it's 11 clients currently in that system, had committed 934 crimes between them. Over, I'm not sure of the period that they had committed those, but since being in treatment, being prescribed heroin, they have not committed one offence. Now, obviously, reoffending shouldn't be a driver for providing good treatment services and for prescribing heroin, but unfortunately, again, it's one that's likely to influence police and politicians. We also have about 200 people in the country who are still being prescribed take-home diamorphine. So diamorphine is the medical version of street heroin. And those are called old systems clients. So these are clients who have been on diamorphine for a number of years. Some of them will have come out of clinical trials around diamorphine prescribing. Others will have been prescribed it, in the early 90s when that was still a thing. So we do have a handful. And in fact, last year we were involved in a legal case in one area of the country where they tried to remove the 20 clients that they had on diamorphine off the scripts for funding and for policy reasons. These were people who were in employment, they had kids, their lives, the quality of their lives were excellent. And obviously that whole process really destabilized them. And I'm thankful to say that the case was settled and the clients are fine. But I think we also have to talk about more than just heroin prescribing. We should be talking about safer supply of as many substances as possible to treat dependency. One of the failures of our current system is that it focuses, and this is no fault of the system because this is where the evidence is focused, is around, we can be very good at providing services to people who use opioids, so substitute medication. We are very bad at engaging people who use other substances like cocaine, crack cocaine, benzos. And in fact, if you look at British Columbia, they have implemented a safer supply model to prescribe alternative or the same drug, albeit a pharmaceutical grade version, to people who are dependent on other drugs other than opiates. And they started that system last year in Vancouver, but they actually scaled it up in March in recognition of the dual crisis of COVID-19 and the drug-related deaths in BC. So I think, you know, what I would say is is what I would like to see is much more innovation in this field around substitute prescribing. And the reason we don't have this innovation, because again, of the stigma that our client group faces. They are seen as criminals, they are seen as drug seeking, they are seen as unworthy, and so therefore the move to prescribe alternative medications is often restricted because it's seen as kind of condoning their drug use, that they're on another type of drug, rather than we're simply treating the condition. Because, and I think it's worth us making this point, is dependency, drug dependency, problematic use, for the 10% of people who experience it out of all people who use drugs, is a symptom of trauma, mental health issues, and actually what we want to do is stabilize people and help them deal with those underlying issues. It's really not about the drugs. They are self-medicating to deal with what they've been through. And if we start to have the conversations in that context, I think we start to destigmatize this issue.
Yeah, agreed on the kind of the current lack of focus on drugs other than opioids in harm reduction services. And I'm correct me if I'm wrong here, it seems to me as though but that's partially because if you look at, say, popular stimulant cocaine, for example, there isn't the same level of availability for substitutes as there is for something like heroin. Now, which came first, the chicken or the egg? It might be that there isn't as good an available substitute because of the lack of focus, or vice versa.
Thank you very much for those bits. I think we've maybe got a good accidental bit of structure, maybe talking at some good bits of shapes of drug policy. And so I guess we've moved on. So we've going to be talking about the drug consumption rooms, and then the prescription of heroin, and perhaps the lack of a typical kind of medication substitute stimulant. So maybe I'd open up to either of you. How would your ideal way then to manage stimulant use? Let's say cocaine, amphetamine. I see you nodding first, Niamh, so shall I pass it back to you first of all?
I am looking up what they prescribe in BC. I mean, in terms of recreational use, you know, what we need to do is, you know, one day have a responsibly regulated market, and cocaine is going to be the hardest because of the international treaties and the fact that it's sourced from Latin American countries. So cocaine, I think, is probably the last one that we'll see regulated. I don't know what you think, Daniel, unless everybody pulls out of the international treaties, which, considering the state of the world at the minute, that's quite possible. But in terms of recreational use, you know, what we need to do is we need to be providing people with clear harm reduction information. You know, I would argue that many of the campaigns that had been undertaken by government have been sort of implied just say no campaigns. You know, it's not quite explicitly saying that, but behind it, you know, they're just saying don't use drugs. You know, we've seen the ones where they say every line that you snort will kill someone in Latin America. That's factually incorrect. But, you know, also that's because of prohibition. You know, that's not because of the choice to use drugs. So harm reduction, I would like to see, you know, people being able to access paraphernalia that reduces risks. So, you know, intranasal pipes. And then when we look at kind of problematic use of cocaine, and possibly more particularly crack cocaine, at the minute, the only thing that's on offer to people, unless they use heroin as well, is talking therapies, CBT, and that's fine, but it's not going to work for everybody. And it's not an attractive thing for people to come into treatment. They don't feel that they're being treated. And they'll also get it for a minimum period of time. So what I would like to see again is that move to safer supply. And I can't remember the specific drugs. I think it's methylphenidate. I'm looking at Judith again. But there are 2 drugs that they've listed in the B. I'll find a link to it and send it to you guys on the chat. There's 2 drugs that they've listed in the British Columbia policy that I mentioned that can be used for the treatment of stimulants. So I think that is very possible. You know, for example, just thinking about methamphetamine use, not big thing in this country, but essentially we prescribe Ritalin to kids for ADHD. Ritalin is a form of methamphetamine. You know, we could start to explore those drugs as legal prescribed alternatives to deal with stimulants.
Yeah, certainly agreed on cocaine being the kind of the hardest case, and that's especially true when it comes to like a broader legalization framework. I know that Steve Rolls, who's a great researcher from Transform Drug Policy, is currently working on a book about how best to regulate cocaine in a kind of recreational sense. When it comes to other, I mean, if you look at, say, MDMA, for example, I think Niamh's covered the harm reduction side of things very well. I mean, most of the models that have been proposed for something like that would be licensed clubs with harm reduction services, perhaps needing a license to purchase, although I'm a little bit wary about that myself. But you can kind of picture it in terms of, you go into a licensed club where they've got perhaps a members club where they have a list of people that are known to them. And when you purchase MDMA, which is going to be having health information on the packaging, you're going to have advice from the trained personnel that you're purchasing that from. You're not going to be served if you're too intoxicated. You're going to be told about drinking enough water, etc. All the kind of the classic harm reduction advice there. But to be honest, it's interesting to kind of sketch out the models of how say MDMA or cocaine regulation would work in practice in a legalized or quasi decriminalized system. But we're so far from that for me the kind of the key areas of work are on what would decriminalization look like and what would cannabis specifically look like in terms of regulation. And there's certainly been a lot more work done on both of those things. I know there was a couple of questions on someone asking how would a regulated drug market work in practice. The answer to that, we got a paper out called The Green Light from last year, in which we sketch out our ideal model. I'd encourage you to check that out if you want the kind of what a more free market legalized cannabis market would look like. If you want to look at a slightly different approach, then again, Transform Drug Policy have done great work on sketching out what their ideal market would look like. There's plenty of overlap, some important differences there as well. But yeah, it's definitely one that I guess there just hasn't been, apart from Transform's work, there hasn't been that much done on the getting into the nitty gritty of what, say, a legalized stimulants market would look like. There was another question that came through from Shayla, I think, who said, I still think from a US context, the legal cannabis market largely excludes any person with a record from partaking in dispensary business. And this is something that really, really irritates me. And I find it absolutely crazy that this is the case. This, like, legalization is a fantastic opportunity to turn what are, you know, in the eyes of some, not me, but in the eyes of some on the right, kind of, you know, criminals, into regulated legal entrepreneurs who are contributing to society, et cetera, et cetera. That's not the way I think about it, but it's the way a lot of people think about it. And the fact that we're not letting them do that, or we're raising barriers to entry to that market for people who have very, very high levels of human capital in being able to run a drug business successfully, let's be honest, I just find absolute madness. So certainly in our cannabis market model, we emphasize that we should let people with drug offenses take part in the market. And that's pretty important if we're going to make a success out of legalization.
Could you, Daniel, outline the ASI position on what you think the cannabis market should look like? You know, overall, yeah, how would you do it, basically?
Yeah, sure. So I can go over kind of broad brush. I mean, from Canada, one of the things that we really liked was the public education at point of sale. So getting your little leaflet of what cannabis does to you and the latest evidence we have on the effects of cannabis whenever you buy some. Legalization being accompanied by campaigns around drug driving still being illegal. Home grow being allowed. That's a very important thing for us. But I guess three broad areas, and this is perhaps where we slightly differ from others in the kind of drug reform sphere. we think that involving private enterprise is important here for a number of different reasons. Uruguay being quite a good example of where not involving private enterprise led to some problems. So if we look at one of the key goals of legalization, which is outcompeting the illegal market and making people able to shift over, unless you have, if you have shortages, for example, as was the case in Uruguay, and as is the case in any initially legalized market, but they continued for a lot longer in Uruguay due to the fact that there was kind of entirely state-run dispensaries, entirely state-run cannabis production. If you have shortages, people aren't going to switch. If you don't have things like some method of online purchase, for example, when you can text your dealer or Snapchat your dealer and they'll be at your door in 10 minutes with cannabis, you're going to do that if you're not able, like if you don't live within 10 minutes of a dispensary, for example. So it's important to ensure that there's access for people so they actually do switch. Similar sort of thing relating to taxation as well. We do support and sketched out supporting taxation by potency, the kind of classic economic justification for that, in the same way that we'll tax higher strength alcohol at higher percent. There is some concern, I'm not sure I totally buy it, but the idea that much more potent, high THC, low CBD cannabis leads to more negative externalities in econ speak, so mental health related concerns, etc. But whilst taxing by potency, not having tax rates so high that the legal market is unable to outcompete the illegal market. If you're someone that is used to paying £10 for a gram, and then suddenly the legal dispensary next to you charges 20, you're going to stick with the illegal market. Obviously, there's some premium to not being worried about breaking the law, but it's not infinite, as it were. The criminal justice component we think is really important as well. So as well as expunging previous criminal convictions, the stuff that we talked about earlier around making sure there is access for people who have had drug-related convictions to be able to enter and participate in that legal market. I think probably the biggest point of disagreement that we had with others in the drug reform space was allowing some form of advertising. And that's something that there's kind of, say, Transform, for example, would advocate for plain packaging when it comes to cannabis. I understand the reason in not wanting to increase use. I'm personally not as convinced that the economics of advertising is about increasing prevalence as an overall product category. The way that I've always understood advertising, and what I think the evidence points to, is that advertising is about boosting a particular brand as opposed to a product category as a whole. And the reason that I see that as important is because basically a brand is a very good way that companies self-regulate for quality. So if you've got a valuable brand, for example, then you're going to try a lot harder to actually make sure that you provide quality uncontaminated products than you are if you're, say, just a kind of anonymous grey package in a shop that no one really remembers the name of. So that's kind of, I guess that's going over some of the areas. Again, I'd say if you're interested in what a more free market approach looks like, then the green light is definitely the place to go, where we go into a lot more detail around issues like taxation and like public use, for example, whether or not we have cannabis treated in the same way as cigarettes in terms of not being able to use indoors, or whether there should be designated facilities where people can smoke indoors. Other things relating to, I guess what I'd like to see in a cannabis market, a legal cannabis market, is a variety of different business models and ways of producing. So there'll be some in the drug reform space that will kind of advocate for, purely, say, cooperative production, for example, or purely very small scale production. I think that the potential shortages from that could be a concern, but making it as easy as possible for different business models to come in and operate, I think, is the best way to go. And through the wonderful power of competition, we see what works best at addressing people's needs. But that's a very brief sketch of what we look to do. But it's I just, to finish off, it's worth stating that I would still massively prefer a more kind of, I guess, heavily regulated, more state-led approach, legalization, than to the status quo every day of the week.
Great, thanks, Daniel. Niamh, I'm sure you've got a lot to chew over from that. I was particularly interested in your views on, I guess, good to stick a little bit to how you'd see the cannabis market, or whether that is the kind of direction of travel you'd go for. I'm interested in your views too on the advertising, plain packaging.
Yeah, well, more picking up on the competition point. I mean, I think competition within capital markets aren't equally distributed. So some people have more power than others. So I think that's fundamental to recognize this doesn't work in an equitable way. And I'm going to share an example of it. Mexico has been moving forward to a cannabis legalization bill for the last 3 or 4 years. I'm trying to remember when. So sort of late 2019, there were 2 parallel bills that were going in. Now, there had been one that had been commissioned by the Ministry of the Interior, and the person working on it was a highly respected academic and drug policy reformist, brilliant man, and he had drafted the bill. What he wasn't aware of was there was a parallel bill being drafted that was coming from lobbying by the Canadian companies, and very heavy lobbying in respect of other ministers who, for some reason, I'm not going to say why, but were seduced by the Canadian companies. And that led to a situation where 2 bills were in competition. Now, the one that was backed by the Canadians sought to have a requirement that cannabis produced in Mexico could only be produced using imported seeds, i.e. their seeds. So this idea of competition being healthy, competition can only be healthy where there is well, I mean, I'm not sure competition is healthy anyway, but it can only be where there is an equality in arms. And the fact is, the vast majority of people who should participate in this market, because of their experience, won't have that level of resources to fight against the big boys. And I say this repeatedly, I did not get into drug policy reform to make white men richer, rich white men richer. And I fundamentally believe that any regulated market must work to transition people from the illicit market into the legal market. And the reason I think that is not that I have any judgment of people participating in the illegal. I think for most people that's a very rational thing. For many people at the lower end of the supply chain, they have limited economic choices, and so therefore that drives them into the market, which gives them some benefits. And also in terms of those benefits are not just to the individual, they're to the community. So that money is spent on what their kids need to go to school. That money is spent in local shops. And if we suddenly allow for an industry to shift into this very kind of white corporate space, we will not only be removing opportunities, we will be making people who live in deprivation even more deprived. Now, I think this all probably sounds as a very lefty, very kind of socialist approach. And it's not really about socialism, it's about incorporating people who have the expertise in the market and who need to benefit from the new markets. And there are 3 states in the US that have what are called social equity models. So California, Massachusetts, and Illinois. And all of them put aside a certain number of licenses to people who have all criminal records are expunged. So that's the first thing. That was fundamental to the drafting of the legislation within those states. So they are expunged. So those licenses, quite significant proportion, are prioritized for people who have criminal records from communities that have been over-policed and those who have suffered from over-incarceration. They are also provided with financial and technical support in order to participate in the market. So I think there is learning that we can have from those 3 jurisdictions. And for me, it's very surprising that that was the US, and yet in Canada, they didn't even consider expungement of records until after the regulatory system had been passed and was in place, which to me was just so socially wrong. I mean, it was corrupt. And then just to finish off on it, what I would also say, and I'm losing my train of thought on this one, but what I would also say on this is that the fact that we have learning from these states means that we can start to advocate for these models. And this is where the importance of having racial justice organizations involved in this movement comes into play, not just for this issue, but for many other issues. But if you look at New York, for example, New York has had, I think, 2 bills before their legislature which aims to regulate cannabis. Both bills failed because they did not have racial justice, reparation, social equity elements within those bills. And that was the drug policy organizations advocating for reform coming together with the racial justice organizations saying, this is not good enough. We will not have regulation at any cost. We have got limitations on where we go. And I would like to see the same thing happening in the UK. And we're working on a paper at the minute on these issues and hoping to get other organizations signed up so that this is civil society's position, because we're up against industry. And I think Daniel will agree with this. You know, I think cannabis will be regulated in the UK within the next 5 years. And that is not because of drug policy organizations, that's because there is a huge amount of money being thrown into this area. It is no coincidence that one of the advisors in Number 10 formerly worked in the cannabis industry. So for me, this is a pressing issue. It's one that we all have to come together on as civil society and say, you know, these are our red lines. And this is what we want a cannabis model within the UK to look like. We want one that is just, that is fair, that is equitable, and that benefits those who have been so excluded through criminalisation historically.
I think I'm going to have to viciously agree with you, Niamh. I mean, I guess, yeah, you're completely right to kind of highlight that, well, even if competition isn't great in and of itself, if we're going to have it, it needs to be real competition. And a classic kind of, like that example with Mexico of trying to lobby the politicians there to only import seeds from Canada. To me, in my kind of world, in my kind of language, classic example of crony capitalism, of anti-competitive measures, if that makes sense. And the same is true when it comes to issues. I mean, you look at some US states that have either prohibited or mandated vertical integration between suppliers and dispensaries, for example. To me, that's kind of, again, in my language, that's unnecessary and distorting intervention in the market. Now, we might be talking in kind of different languages based on, you know, our respective kind of ideological positions more broadly, but we're coming, I think, to very similar conclusions on a lot of this. I mean, even when it comes to something that I imagine there's a fair few on the centre right that would be a little uncomfortable with, say, the sort of social equity programs that we've seen in various US states. There is a very wide range of like libertarian literature that talks about reparations in various forms as being something that is actually very libertarian and very consistent with a free market position. If the government's approach to drugs has disproportionately harmed a particular group of people, then you know there is a strong logic behind making sure that they're compensated in the process of legalization. And I think that whilst the social equity programs are an important part of that, I'd also say when you spoke about, say, setting up a certain proportion of licenses to be prioritized for people with criminal records or previous involvement in the drug market, that's great. For me, what would be even better is if there wasn't a limit on the number of licenses so that they could get involved. Yeah, you know, it's one of those things where there's a curious kind of coming together.
The only thing on that, Daniel, sorry, I am going to jump in on that. The only thing on that is if you don't have a prioritization, and so again, we're aware of situations where these social equity models are attempted, and so people are getting the licenses, but those who are part of companies are coming in and buying the licenses off them, or in them as proxies to be involved in the market. So if we don't have some kind of system in place that protects those people, then I could see a case where you have industry overriding the purpose of the scheme, unless you're saying that all of the licenses should go to people from the background, which I'm fine with that.
I mean, I'd be tempted. I'd be tempted. I probably have less of a problem with something like that than you do. So let's say someone from a kind of more marginalized community acquires a license and then it's bought off them by a big conglomerate cannabis company X. Now, I'm not so, if it's a decent price and they get to make a lot of money very quickly as a result of that, I'm less bothered. But I think that probably comes down to a difference in kind of ongoing involvement in the market being an important aspect of this, as opposed to just kind of making a quick buck, as it were. Yeah.
Yeah, that was really, really good interactions there. And one question something I wanted to pick up, and I'm sure pricked up about 71 of the 71 ears there. So you think we're going to be legal and up and running in 5 years? So I guess so I'm interested. So you gave your reasons. You think big money is behind it. I guess there might be one or two reasons that our economy might need its own stimulation soon. So can you take us more through, Niamh, what you think the process will be? So I guess you're not thinking there won't be the famous cannabis general election you're imagining. So I don't know if your knowledge of policy, what you're expecting the process to be from here to day zero. So yeah, how do you think the process will be? I guess
that's a good question.
How will we get there? And then I guess I can imagine you're prepping yourselves to try and have your influence on the policy. Yeah. So how will we get there, and what do you think it will look like when we do get there?
My fortune ball, what is it? The future. I mean, this is just based on kind of working within this field. Yeah. And I think in the last few years, and I think Daniel will probably agree with this, we have seen business courting NGOs like us. That didn't last long from my point of view. But, coming in, asking us to be part of conferences, going to dinner, asking us how we can bring legal cases, thinking it's like the US or Canada, and that started to happen way back in about 2012 with various industry people. I think, I'm not even sure it'll be an election issue. I think this may happen even before the next election. I think, and that's largely because of who is in number 10. I would say that, if you look at the financial benefit that some politicians are already gaining from the legal medical market, that's pretty interesting. So our previous drugs minister, Victoria Atkins, had to recuse herself from talking about cannabis because her husband heads up British Sugar. Is that right, Dan?
Yeah.
Yeah. Which are one of the largest producers of legal cannabis in the UK. Theresa May's husband has shares in that industry as well. So we can start to see kind of politicians seeping in, or their partners seeping into this market, which gives it a level of legitimacy that I don't think we've ever previously seen. And for me, that is instructive of kind of where the politics are going. I don't think this will be a big public campaign. I think it may be around the huge recession that we're going to face. But I think that it will largely be driven behind closed doors with lobbyists. And we will work really hard to get our voices heard, but it will be a huge, huge challenge. So yeah, that's my sort of looking into the next 4 to 5 years.
Yeah, I think one of the things that I'm perhaps more pessimistic of, but many in the drug reform movement will probably be a bit happier with if this ends up being the case. I don't think we're going to, if and when we do, I don't think we're going to end up with the sort of model that I would be a fan of. The reason is, whilst it's true that we have kind of a high level of corporate interest and involvement in this sphere in the UK, the government's general approach in relation to kind of public health issues more broadly is very, very pro-regulation. So, think of the latest obesity-related policies, for example. A lot of support for introducing minimum alcohol pricing in the UK. Lots more crackdown on tobacco and things like this. I think that will broadly be mirrored in whatever cannabis policy we end up with. I'm sure this will be music to the ears of some of you. I don't think we're going to end up with the kind of corporate utopia / dystopia in the UK's cannabis market. I just don't see that as particularly likely. But yeah, and I'm fairly convinced as well that it's the kind of 5 to 10 years. I'm not sure if it'll be this government or at least this parliamentary term. But certainly, I mean, Boris has for quite some time been fairly liberal on drug reform. I am becoming less and less convinced that he is a principled liberal on anything. But maybe this is an area where that's an exception. I mean, you take immigration, for example, you know, there's been some moves towards liberalisation there, but broadly speaking, I mean, we're not hearing anything about a migrant amnesty anymore like we were at the start. But in the kind of current Conservative Party, I think there has for some time been a silent, not majority, but a silent large minority who are certainly interested in the recreational side of cannabis legalisation. And to kind of defend a little bit here from people who are broadly a similar view to me, I don't think it's just because of corporate influence. Whilst that certainly plays a role, I think that there are a number of people who have principled classical liberal stances as to why they think the cannabis legalization works. And they are concerned with, in many ways, similar issues that we're talking about today relating to criminalization, relating to the illicit market. So it's not all kind of, you know, it's not all disingenuous. So I just want to make money out of this. I'm sure that plays a role. Don't get me wrong. I'm not naive about this. But in terms of the other parties, I mean, if you look at Labour, for example, they've made some real strides in their broader approach to drug policy quite recently when it comes to supporting a royal commission and looking at decriminalisation as a viable option. Obviously, it hasn't been adopted as a party stance yet, but if we end up with a Labour government, I'm certainly more optimistic for the sort of reforms that Release tend to champion. And actually, I'd agree that if we had the choice between legalising cannabis under the Conservatives or full decriminalisation and public health approach under Labour, I prefer full decriminalisation and a public health approach under Labour. Thankfully, I don't think those two kind of cancel each other out in the long run spirit of things. But yeah, like I'm pretty convinced it's 5 to 10 years. Especially you look at public opinion on this as well. Like I mentioned at the very beginning of this, the polling is now consistently showing majority support for recreational cannabis legalization. That hasn't happened before. And even, you know, when I've spoken to Conservative MPs and made it clear, well, you know, even the Conservative members are pretty up on this, like 50-50 split is, you know, it's pretty surprising for me. I thought it would be a lot more opposition than there was. That polling was done, if anyone's interested, by the Conservative Drug Policy Reform Group, which is Crispin Blunt MP's outfit. If anyone wants to delve into the details of that a bit more, but yeah, I'm optimistic. Not very soon, but soon.
And just to add, someone's brought up about homegrown, and I see Daniel's responded. That has to be core to any policy reform. People have to have the right to grow at home for numerous reasons, and we should also be supporting the cannabis social clubs, which have been, you mean, they operate across the country, technically illegal, but these are people who are coming together to produce cannabis in a kind of cooperative way in order to support people with medical conditions who need access to cannabis and can't currently get it through the NHS, because frankly very few people are getting it through the NHS. So I think those systems should be supported. I think those can also be supported around decriminalisation and thresholds. So interestingly, and I really encourage you to go on to the Talking Drugs website. I'll share the link for the map. We did a whole analysis of the different jurisdictions that had decriminalised, and quite a few of the US states who had regulated cannabis also had underneath the decrim model where you could possess up to a certain quantity of cannabis, and it was quite generous, but also you could socially share your cannabis. So I think those kind of things are fundamental components of an effective model for cannabis reform. I'll share that map now.
Just doing some link sharing in the chat myself.
Yeah. Sorry, were you going somewhere?
Just very quickly. The kind of the homegrown issue to me is a good kind of way of highlighting the difference between a corporatist approach and a more free market one. In that I imagine, and I believe this is the case in some places, that companies might not be too happy with competition as they see it from people who grow at home for various reasons, whether medical or because they're hobbyists who want a very particular strain, for example, and that kind of lobbying for regulation and in keeping up barriers to entry, and that results in criminalization, that results in all of the negative consequences we've spoken about, is the polar opposite of what I'm about and what the Adam Smith Institute is about as well. But go on, James, just a quick one. Just a quick aside.
Great, thank you. So just following up on your points, both of your points there again. So if you think it's happening, it seems possibly within the 5 to 10 years, I wonder why now? So, people mentioned the corporate case, but I guess that case has been around for a while. Do you think what is it about this cohort of, influential decision makers who are likely to go where nobody has been before? Is it that this kind of came of age in the 80s or early 90s libertarian mindset? Is it what was on recreationally in the 80s and early 90s, which might even influence some of these people? Or is it simply, Daniel mentioned, the opinion polls between, for and against to legalise cannabis is tipping towards more people, possibly even the Conservative Party membership, being for some type of policy change. And so, as well as that, so why now? And you mentioned what you think the direction of travel in the main two parties is. Someone said it's unlikely under Sir Keir. Don't know if either of you have anything on the direction of travel within Labour, and perhaps adding anything else on perhaps why it is it's the Conservatives who have done it, since not many people would have thought, it will be the Conservative Party to legalise drugs.
I could be completely wrong, so don't all your money on it.
Yeah.
So, what I would say is why now is because it's been done. That's the main reason. And why it was done is probably instructive. In the US, they have what's called ballot initiatives. I'm not sure if everybody's aware of those, but at an election, what you can do is prior to the election, you put forward a proposed change in the law. And if you get a certain number of signatories, that is added to the election ballot. So you can vote for that legal change. So most of, and not all, which I think is important now, but the early states that adopted cannabis regulation in the US, the vast majority of those were on the US, on the electorate ballot, and they were successful. So I think it was, I can't remember, in 2014, I think more people voted for cannabis regulation in the two states than they voted for Obama, something like that. And what's happened there is these the ballot initiatives have shown how these models can work and work effectively. And so from that there, we then see US states, the legislative bodies taking this forward independently in the absence of a ballot initiative. Not all states have ballot initiatives. So I think that between, 2014 and 2020, we've gone from 2 states in 2014 to, is it 12 now, Daniel? 11?
11 or 12, good question.
Yeah, I think there was one just went this morning. Somebody else just went this morning.
Yeah, 12.
Legal cannabis is now available all the way down the west coast of the north of America. You can travel from the tip of Canada to the Mexican border, and that will be added soon, and you can buy legal cannabis. That obviously influences hugely the perception politically on whether these models are achievable, whether it's politically risky, etc. There will be people looking at how these things have happened in the US states, where the public support, what's been the backlash, what's the evidence coming out of that. Couple that alongside an industry that has boomed in the space of 5 years. The corporate influence is part of this. So I think that's the why we're here where we're at now. I just, as I've said, the fact that there is someone who worked in the cannabis industry in Number 10, the fact that we know that industry has been meeting with politicians, that politicians' spouses have been involved in benefiting from the trade. These are all ingredients that would indicate that there is movement on this issue. As I said, I could be wrong. In relation to Labour, they've taken a really thoughtful approach. So what they've done is they've undertaken a review where they've gone across the country, and I know Judith and others have been involved in this, and they've consulted with local people about drug policy. The main line for the review is the current approach is a failure. So they accept that. It's not like they're in any way considering ramping up criminalisation. It is that criminalisation has failed and criminal justice responses have failed. So it's looking at alternatives. And Charlie Faulkner is leading that. I think that's a really important sort of symbolism of how the Labour Party is viewing this. Jeff Smith and Niamh Debonair have set it up. Both MPs from Manchester and from Bristol. Jeff talked about his own Class A drug use when he was a DJ. You know, so I think there are real opportunities. I would not want to see a Royal Commission in relation to decriminalisation, in relation to drug consumption rooms, in relation to heroin-assisted treatment, in relation to safer supply. We have the evidence for that. A Royal Commission just bats it down the road. So I think with other more sticky issues like regulation, maybe less so cannabis regulation, we may want to have a Royal Commission. But in the main, what I would want to see is action rather than another bloody review.
Yeah, likewise. Certainly on the kind of the demystification of regulation has definitely played a massive role, as Niamh said. I think the other thing has been seeing the sort of, I guess, the groups that have campaigned for legal regulation in other jurisdictions. If you look at Canada, the campaign around that was from the perspective of we need to protect kids and cut crime, police officers fronting it. That kind of, I think, dispels in a lot of people's minds the kind of what some people see as the motivations for drug legalization. And there's nothing wrong with libertarians with the crazy pipe dream supporting legalization, don't get me wrong, I'm one of them. But in terms of public support, it's certainly been like this coalition of civil society that I think has made some politicians realize, okay, this isn't this kind of strange fringe issue. Actually, the majority of the population support it, and actually it's getting support from all of these different quarters as well. And I think, you know, you've got to credit a lot of the drug reform organisations for helping to bring together those coalitions. I mean, Niamh, you might be doing yourself down when you're saying that we're going to get legalisation as a result of corporate influence, because without the kind of the work that's been done by all of these different drug reform organisations and bringing together these very different and disparate groups to advocate for the same thing, from the appeal to people with different views, then I don't think it would be possible.
Yeah, great. This is excellent. We've hit a point to an hour and a half, where I think we had thought it as a potential stopping point, but I'm not advocating directly stopping now. So first, I don't know if there's anything else you or Niamh particularly want to get off your chest, which we haven't kind of got to in our roundabout structure so far. But also, if anyone else on...
Yeah.
Don't look at me. Yeah, I mean, I guess I just...
It's N-O-T. Yeah, he does the Frito, innit?
I think we might have a rogue speaker on.
Yeah, I think so. Chris, are you able to mute and evict?
Yeah. There we go.
Hey, thanks, Chris.
Just a bit of shameless promo for our latest paper, which is on drug policy related issues. And something we haven't covered too much in this is the psychedelic space, where there's a lot of very interesting things going on right now in terms of decriminalisation initiatives in some US states, but also the kind of medical potential that hasn't been fully explored. So some of you may be familiar with psilocybin, the active ingredient in magic mushrooms, and we've just released a paper with I'm not sure if Joanna's on the call, and plenty of other fantastic experts in this area talking about how to free up research into the use of psilocybin and other psychedelics in order to further research into potential medical treatments for treatment-resistant depression, for PTSD, for anxiety. There's already very good early clinical evidence that these may be effective and may be a paradigm shift in how we treat various mental illnesses, and they work in a completely different way and have various other benefits relating to cost, for example, relating to being able to go into a clinic, have a quote unquote psychedelic trip, and then not need treatment for months afterwards as well. And again, this is kind of the curious libertarian broader drug reform coming together, in that there's too much damn home office red tape here when it comes to researching these substances. It's very, very difficult, costly, and time burdened to do so. So if anyone's interested, check out our website, adamsmith.org, and go in the research section. We managed to generate quite a buzz, and hopefully we'll be able to get that changed and encourage more research. That's all I wanted to get off my chest.
Thank you. Anything, Niamh? And also, if anyone has any questions they'd generally like to ask about any viewpoints we haven't heard so far about the working on us, please do chuck that into the chat, and we will ask the two speakers while we still have got them. But Niamh, if you have got anything else you would like to spontaneously...
I think I've covered everything that I wanted to say. We've done pretty much all of the stuff we've had. I've shared the Black review. So Dame Carol Black is undertaking a review of drugs in the UK at the request of the Home Office, and she released the first phase of her report back in February 2019, March 2020, which was largely sensible. And what I really liked about it was that she recognised that it was the social and economic inequalities that drove lots of the harms within drug policy. So for example, the discussion around county lines, which I have a little bit of a problem about, in the sense I think this is a new drug scare that is being put on politicians and the NCA in order to make themselves relevant. There is definitely discrete harms of that market, but there's always been harms in this market. But she really focused in on the social and economic inequalities. So I've shared phase 2, which looks specifically at harm reduction. Well, thank God harm reduction is there. I don't think we've had a Home Office document saying harm reduction since before 2010. So at least that's back in. But it also looks at prevention and treatment and young people. What was interesting was she was prevented from looking at legal reform. That was not part of the terms of reference. But what we argue is that you cannot have effective treatment, prevention, and harm reduction without legal reform. So spent 2 weeks on it, so please take a look at it. Somebody reads it, would be great.
I've got a question there. Somewhat, we have a question from, if I can scroll up to get the name as well. Oops, where's it gone? It's on NPS, so for novel psychoactive substances. Do you think the explosion of novel psychoactive substances, also called legal highs, when before they were all made not legal, what impact do you think those have had on the legalisation debate and likelihood of change?
Can I go for this one first? Okay, because I have been pestered for the last 3 weeks by media around nitrous oxide. I have to talk about, well, I will talk about laughing gas, but I have to talk about it on radio or TV one more bloody time. I actually, in terms of NPS, yes, there are significant harms around things like synthetic cannabinoids, and also the increasing prevalence of synthetic benzos. But what I would say is most of those synthetic benzos are regulated under the Misuse of Drugs Act rather than within the remit of the Psychoactive Substances Act. There's been a lot of reports of explosion of nitrous use. I think you'll have seen it in the media. And during lockdown, we have undertaken a survey to which we've had over 2,000 responses so far. Nitrous is on the list of drugs that you can indicate that you've used or purchased. The brilliant Professor Judith Aldridge is analysing this work. Judith's at University of Manchester. And she sent me some of the early findings, and we had 0% response for nitrous. In the same way, we, Crew 2000, who are a brilliant organisation in Glasgow, have been doing surveys every week for the first 3 months of lockdown. and they do the top 10 drugs that people are using, nitrous isn't in there. So I think what we're seeing is, as I keep saying in the interviews, is a littering problem. There are canisters on the streets, and adults are frequenting parks in a way that they haven't historically done, where kids would normally be. Kids are in the parks because they have no closed spaces. And also too, you mean less cleaning because councils are focused on other things. So you mean it's interesting how, again, we're seeing a drug scare around a, what's a novel, it's not that novel, it's 200 years, 300 years old. But you know, what's within the definition of novel psychoactive substances in light of the legislation. But we're seeing another panic. And we keep saying in the interviews, and David Nutt, Professor David Nutt has been doing this too, this is one of the least harmful drugs that you could use. Like it is I don't want to say safe, but almost. It lasts for 45 seconds. There are problems for people who use really, really heavily. And what we need to do is give them education and pathways for support. There's advice we can give on safer use. There are reports of people putting bags over their head, not a great idea. So there are ways we can deal with this through public health messaging. But what we've seen is heavy crack. You know, comparing nitrous, a 45-second lasting drug, to heavy crack cocaine is a nonsense. You know, we've seen, you know, a parliamentary debate on this issue last week or the week before. We're in the middle of a global pandemic and we're talking about nitrous in Parliament. I mean, this is just a perfect example of a drug scare. Now, I know that doesn't answer the question, but in the same way that I will now answer the question. So in terms of novel psychoactive substances, under the legislation, possession of it is not an offence. So it is decriminalised already for people who use the substances. So that's the first thing to say. We have these two pieces of legislation, one that criminalises use, one that doesn't. The reason it doesn't is government said it did not want to needlessly criminalise young people. But yet they do it with the other piece of legislation. So that's cognitive dissonance there. And absolutely, regulation. We start to look at models of how we can do this. I think nitrous is one of the most easiest ones. I don't know what Daniel thinks, but I think we literally could do that tomorrow without much difficulty.
Yeah, certainly. I mean, nitrous is pretty up there in terms of something that's easy to regulate very, very quickly. On NPSs, more broadly, I mean, when we first had the Psychoactive Substances Act come through, we were pretty vocal in thinking it was a ridiculous piece of legislation. I don't know, some of you may remember the initial drafting criminalised sniffing flowers and all sorts of absolutely ridiculous things. It was just so poorly worded. And it was, I mean, unbelievably hypocritical for a party who said they were concerned with preserving the UK's legal identity. They wanted to undermine centuries of British common law by saying that you can't do this unless the law explicitly allows it. The main problems that caused, the kind of crackdown on NPS. I mean, the first is it really harmed medical research. It made it a lot more difficult for people to research new psychoactive substances. But when it came to people who use these themselves, I mean, it undermined harm reduction. So initially you had these head shops, which were no means centers of excellence in harm reduction, but you at least had people that were, well, in some cases they might have been. I haven't been to one. But they, you know, you at least had some advice about how to take it. You had some sort of manufacturing oversight. It wasn't great, but now you've got a situation where, again, you've handed something over completely to the criminal market. You've got absolutely no advice about how to take it. And, you know, the only reason that most of these substances are used in any number is because of wider prohibition for substances that people would use otherwise. It's yeah, it's frustrating and ridiculous. But yeah, we should definitely go for nitrous first. I think that'd be a nice easy one. Agreed. A good question just came in. How can those of us working on the ground in alcohol and drugs advocate for changes that emphasize social and economic justice? Specifically, do you see opportunities for drug and alcohol organizations to work together? I'll just say something quick on this because this is really for, I guess, more for you, Niamh. I'm a little bit worried that some of the drug reform movement may go a little bit towards the way of the alcohol movement in being being a bit too public health focused for my liking. And I don't just say that as a kind of libertarian who wants a free for all. I say it because I think a lot, as we've discussed, I think a lot of the kind of proposed regulatory interventions in legal markets that kind of come from this broader public health debate can actually be bad for various different groups. So, you know, your kind of minimum maximum pricing, for example, that creates a whole host of issues that undermine legalization's aims. There's definitely some crossover, and I'm not trying to say that I don't think public health is important. I'm someone who thinks that you have to balance that with some of the other objectives of legalization, as it were. But yeah, more one for Niamh, probably.
So yeah, I absolutely think that it's so important for drug and alcohol treatment providers, particularly drug treatment providers. I know, obviously, my point being alcohol is legal, and this is the issue. So from a policy perspective, the work that you guys do on the ground is being hampered by the current legal framework. Now, whether I've mentioned criminalisation loads, but our paraphernalia laws mean that you cannot give out crack pipes to people who use crack. And that's important for a number of reasons. You know, one, it means that there is a reason for someone who uses solely crack, and I mean not heroin, to come into a needle exchange. That's a great way of engaging someone in the first instance. It allows them to check in with you about their health. But the law prevents you from doing that. It is an offence for you as a drugs worker to do that. I mean, the other areas we've already mentioned that are hampered legally are around drug consumption rooms. So I think there's a real opportunity for people who are working on the front line, and I should say we work on the front line too, because we deliver legal services in drug treatment services to address people's homelessness, housing insecurity, debt issues, access to welfare benefits. So we do see these things on a daily basis. But what I think it is, it's starting to tell the stories of people, how they've been impacted by criminalisation, or how your job is restricted because of the laws that are in place. And then if we can start to share those stories, because stories work so much more effectively a lot of the time than data. You know, we've got evidence up to the hilt in relation to methadone, for example, and yet this is the most stigmatized medication in the world. So I think, you know, the more that we can get storytelling coming out of drug treatment services, the better. The other thing I would say is that we work closely with a lot of the big organizations, and many of them have been great in recent years in getting clear policy positions at the top of how they think drug policies should work. So I think the majority of them now are behind decriminalisation. So I think that's some, like, working within the organisation around reform is really important. I see you also mentioned racial justice organisations. You know, I think teaming up locally with people who are working within communities of colour to talk about the harms of drug policing locally. We've all seen the social media videos over lockdown. One thing I'll share is under lockdown, the Metropolitan Police in May, when we were under full lockdown, managed to carry out more stop and searches than had been carried out since January 2012. It had increased by 83% on the previous 2 months. And the people who were being stopped, young black men around drugs. So I think the way that we start to tell those stories too are really important. I see Dwayne Francis is on the group today. Dwayne is one of those people who's gone forward nationally with his story of being stopped and searched and the damage that policing does, both in terms of undermining trust and confidence, but also that humiliation that stop and search creates. So those are things that I can think of. The other thing is there are local reforms that are happening as well. Daniel already mentioned police forces that have diversion schemes. So these are street diversion, when someone's caught in possession, they are deferred to a short educational course, a bit like a speeding awareness course. So there are 4 police forces across the country. If you're interested in talking to your local police force about that kind of approach, it's not quite decriminalisation, but it does achieve a lot of the similar outcomes. And it's kind of done in the absence of political leadership around reform. So if you're interested in that, contact me. My email's on the website. I'd be really happy to link you in with police officers who are leading on this issue in their areas, who are very happy to talk to other police forces to try and scale this up. So I think those are some ideas. Did that answer the question?
Yeah, I think it did. Do we have any more questions there? Or is it possibly even time to call it a day? Since nothing's pinged in now, nothing's on our back channel. No, I think indeed I might then call a close to proceedings. But thank you so much, Niamh and Dan. It's been absolutely fantastic. As I said, it's the first one we ran of these, so I was very worried it would be incredibly awkward and absolute car crash, and it was exactly the opposite. So thank you so much for making it so. Thank you so much for also Chris Chandler, Joe Neal, been working hard in the back channels. Thank you. And of course, a huge also thank you to everyone all the guests here at home. Hope we'll see you see you again for the next ones. And so I will finally, before I go, I've actually remembered to plug the next event. So I will just send to everyone, here's the Facebook event, join there and use it to invite all of your friends, and I'll put the Eventbrite as well to join as well. And I will also, in a second, Chris, could you make me host so I can project the flyer? So in 2 weeks' time, we have David Stewart and we have Dr. Janie Sewell, who will be, 1 second, who will be talking to us about chemsex. So today it's been all about policy, and next time it will be much more about a particular type form of drug use, which is, you know, particularly stigmatized, not hugely. I don't know how much it is known about. It's so chemsex, for those who are not aware, it's a very particular form of drug use where gay men use drugs such as methamphetamine and GHB to enhance sexual pleasure. And so we have two foremost experts on that. We have Dr. Janie Sewell, who's PhD, primarily concerned chemsex, prevalence, changing patterns. And we have David Stewart, who in fact coined the term chemsex. So it'd be great to have more of you back again. We've got, oh yeah, I thought we had the wrong date, no we don't. We have the correct date, Friday 21st of August, UK time. It is 12 p.m. I've put the Facebook group and I have put the Eventbrite link in the chat. So great to see you there. And so yeah, I think that is, thank you very much all. Thanks for joining. And yep, I hope to see you all again soon.
Thanks a lot, James. Appreciate you all hosting this. It's been great.
Thank you very much.
Thank you.
Thank you all and goodbye.
Thanks, guys. Have a great weekend, and I'll see you in a fortnight.
Bye, guys. Thank you. I was waiting to see if you're staying on.
Me too. Yeah, I wasn't sure what was happening. That was amazing. Thank you so much.
Well, it was a pleasure. Thank you for organising.
Yeah, cheers. Really enjoyed
It's
that.
still live on
Good chat.
Facebook.
Yeah. Hello, Facebook.
To all James's hard work. Thank you so much. It's brilliant.
Yeah, cheers, James.
Oh no,
Thanks,
thank you.
guys.
Excellent.
Hope to catch up with you soon.
Cool. See you. Have a great day. Have a great weekend. Cheers.
And you.
Have a good trip, Joe.
Enjoy the heat.
Oh, thank you.
Bye.
Bye.
Bye. Thank you.